And thank you. Good evening, and thank you for joining us for another edition of our Ask the Doctor series. I'm Titania Bailey, president of Arc of Knowledge, Inc. And for those of you unfamiliar with our organization, Arc of Knowledge is a nonprofit organization that strives to bridge the gap between our youth and seniors to create bonds that transcend differences in age and ability and ultimately create supportive and engaging environments. As part of our generational health and well-being initiative, we have the pleasure of partnering with MedStar Health and their team of specialists to provide education and resources that promote better health practices. Today's Ask the Psychiatrist session features Dr. Karina Freitas, Psychiatry Department Chair and Medical Director at MedStar Southern Maryland Hospital Center. Dr. Freitas oversees the treatment of patients in an acute inpatient psychiatric stabilization unit. She is triple boarded by the American Board of Family Medicine and the American Board of Psychiatry and Neurology and General and Forensic Psychiatry. She's actively engaged in the practice of both clinical psychiatry and medicine, as well as academic and regulatory medicine. She's an active member of several committees and is also a member of the Assembly of the American Psychiatric Association, where she's helping to pursue improvements in psychiatry at the national level. She's involved in the American Academy of Addiction Psychiatry and is the Psychiatry and Behavioral Sciences Program Committee Chair at the American Academy of Forensic Sciences. Dr. Freitas has presented at national and international conferences, published several peer review articles, and frequently serves as a peer reviewer in the Journal of the American Academy of Psychiatry and the Law. And in her spare time, she enjoys spending quality time with her family and her pets, as well as traveling as much as she possibly can. Please welcome Dr. Karina Freitas.
Thank you so much, everyone. I will reshare my screen. Thank you all for coming on this Thursday evening. I'm sure there could be other things to do, especially with this lovely weather. But I am here to talk to you about a few important topics that many of us don't think about sometimes. So a little bit about my agenda. I'm going to go over what is serious mental illness. I'm going to focus because otherwise we'll be here until tomorrow. We're going to be identifying the risk factors of serious mental illness. Try to know what the signs and symptoms are of serious mental illness, how we can help people in times of a mental health crisis. We're going to go over some myths about hospitalizations and medications. We're going to talk about living with a healthy mind, and we're going to allow some time for questions and answers at the end. I am a fast talker, so if for anyone I speak too fast, please just raise your hands or put a message in the chat. So what is serious mental illness? Without going in the intricacies of diagnosis, I'm just going to put the slide up briefly and show you that it actually is a lot of things. Not only primary mental illness, but also medical illnesses can have serious mental illness as a kind of a side effect or symptoms that go with that medical illness. So without focusing on that the particular diagnoses, we're going to focus on what serious mental illness is as a big picture. So first and foremost, risk factors of serious mental illness. We have modifiable risk factors, drug use, especially at an early age. And yes, cannabis and alcohol both are legal substances, and they can have quite serious repercussions on one's mental health. Medication side effects can result in serious mental illness that is temporary or chronic. Frequent stress or significant stress, recurrent trauma, physical, sexual, or emotional, family conflict or family dysfunction, homelessness, and static factors that we cannot change are, of course, genetic predispositions, such as a family history of serious mental illness, brain injury, if someone suffers a traumatic injury to their head, such as a concussion or severe trauma of some kind, stroke, and of course, also age. as serious mental illnesses tend to have a specific distribution within age groups. So serious mental illness can actually present suddenly or can come on insidiously. So when it happens suddenly, usually within a day or a couple of weeks, we really want to focus on looking for an underlying medical issue that is happening. We want to advocate for our loved ones. If they go to the hospital and medical illnesses are not being ruled out, we want to make sure that we advocate for medical illnesses to be ruled out. We would want to make sure, in a case of an elderly loved one, we would want to make sure that urinary tract infections are ruled out, or pneumonia, or any kind of infections that otherwise are not very severe in the population. However, our older parents and loved ones tend to be affected a little bit different by those insults to their body, and it can manifest as a psychiatric symptom. New medications. If a new medication is introduced, no matter what age you are, you can have a side effect from it that looks like psychosis or mania, or even depression, suicidal thoughts, things like that. And drugs. I know a lot of people, now that cannabis is legal, will use cannabis. However, not everyone responds to cannabis the same, just like with any other medication or food for that matter. Some people are allergic for some foods, some people are intolerant of some foods. Same with cannabis. For some people, cannabis can be very helpful, and for some other people, it can be extremely detrimental. And it can cause psychosis and depression and catatonia and anxiety and all sorts of things, especially if one is genetically predisposed to something like that. And then we have serious mental illness that can come on slowly for months, weeks, sometimes even years. And that can also be cause of medical illnesses, of course, but not very common. Usually, for example, illnesses that are more prolonged, like multiple sclerosis or multiple myeloma, things like that, there are medical illnesses that would cause slow progression of mental illness, maybe Parkinson's, things like that. As neurological illnesses. But of course, usually if they take longer than a month or a year, most likely a psychiatric illness should be considered. Of course, ruling out in the absence of chronic drug use or alcohol use. I can't see. There we go. So silent signs of serious mental illness are things that can happen to our loved ones, such as paranoia. And when we say that, what we mean, the behavior is that they start believing that someone is following them or spying on them, maybe through their messages or maybe through the cameras on their computer. Now that could be true. However, we can see that if it's really distressing and really not amenable to a rational conversation, or if you put a sticker on it and you still have the same fear, that can, that is paranoia, when it just goes above and beyond regular everyday concerns. And ideas of reference, what we say by that is believing that we see all sorts of signs in everyday things, such as seeing, excuse me, a plate, a license plate that says a particular thing that one might interpret that it's a sign from God or some other entity of a greater plan or something that they're supposed to be doing. They could be seeing things in the different colors of coats of people, saying like, that person's wearing red today, which means something to them. Things like that. To get text messages from spam, and they think that it's some sort of manipulation of their minds. Thinking that TV is talking to them or about them, thinking that others can hear their thoughts or actually insert thoughts into their heads. Also isolating. If the person hasn't usually been an introvert and they start isolating more and more, they're not caring for their activities of daily living. They're not showering as they should. They're not really eating as they should. They're not drinking as they should. They're not enjoying their hobbies as they should. Talking about deaths, even in subtle ways, such as wishing not to be there anymore. maybe you'd be better off without me, things like that. We should pay attention to social media, especially for younger folks, because they tend to express things like that, not only in words, but in the songs they post and share, in memes they share, photos, all sorts of things. Also believing in strange things, like my family was replaced by imposters, body snatching kind of ideas, or all sorts of other weird things that all of a sudden show up. Lots of families tend to notice these things, and it is normal for someone to want to just let it go for a little while because maybe they're too stressed, or maybe they are too overwhelmed, or something recent happened, and they just hope that with time it will go away. Less subtle signs are talking to yourself very loudly, yelling, becoming very aggressive when you're not, destroying property, attacking people, telling you that there's something there when you cannot see it, unable to sit still, constantly pacing for no reason, cannot sleep. And even without sleep, they remain energetic. That's part of mania. Talking a mile a minute, sometimes not making sense, changing topics very frequently, starting tons of projects, hobbies, new ideas.
I'll take them up there.
I'm sorry, can you mute yourself, please? Starting tons of projects, new ideas, and new hobbies, and not really finishing them. Spending lots of money recklessly to the detriment of one's well-being, such as spending all of their money that they had for food or for rent or for gas, obsessively preoccupied with things. And I'm not talking about the OCD things that people call OCD as a mundane thing where you want to make sure everything is the right way you want it. I'm talking about being so excessively preoccupied with something that you're unable to actually perform your daily activities because you're just thinking about this one thing and it's putting your life on hold. And of course, putting yourself in danger, walking outside in the middle of the winter, naked or inappropriately clothed, driving recklessly, stopping in the middle of the road, getting out on the highway. So putting yourself in danger and others in danger, those are less subtle signs. Who needs to be hospitalized? Not everyone needs to go to the hospital to be stabilized. There are various options. We do have something called an intensive outpatient program or a partial hospitalization program where people can go daily to the hospital and see a psychiatrist and see a social worker and go to groups and have therapy. So for those people who do not necessarily need to be hospitalized because they do have some insight and good support and are able to engage in treatment, that might be a way to be able to stay at home. Being with family is an important part of being healthy. So those people who need to be hospitalized, the ones who have lost the ability to care for themselves, the ones who plan and have taken steps towards wanting to harm themselves with the purpose of death, and the ones who attempt to hurt others because of symptoms of mental illness. So for example, someone who is paranoid might think that their neighbor is stalking them and they want to harm them and their family. And so this paranoia develops over time, and it develops into a plan for them to stop the neighbor before they hurt them. So they can develop plans to hurt the neighbor because they think that the neighbor is about to hurt them or their loved ones. When to get help? Early. As early as you can see the symptoms. If you can see the subtle signs, encourage an open sharing conversation at home. This is what I'm noticing. I want you to get help. Maybe we can go together, whatever you feel like your loved one needs. But it's best to talk about these things as early as you notice that there's something wrong. Talk to your doctor or call your local county behavioral services office. You can Google that. Literally insert here county behavioral services offices like PG, Baltimore County, Montgomery, whatever it is. And Maryland courts will have, the Maryland websites will have available information for who you can call in the community. Also, your insurance might have some information about that. How to get help in a crisis. This is very important to know what the resources are in Maryland if you are in a crisis. Your loved one is in danger or you are in danger. So if the crisis is moderate and you feel like there needs to be an intervention right now, but there is still some control within the family unit, and your loved one or the person is amenable to getting help, there's several numbers you can immediately reach. So 211, I don't know if the young folks even know what 211 is. You can get any information from 211, including crisis help. You can call 211, and actually Maryland uses 211 quite frequently. You can call 211 and ask to speak with someone because you're having a mental health crisis. You can text 211 during a mental health crisis, or you can ask them for referrals in the community for some mental health needs. Also, 988 is the new number that is the National Crisis Suicide Hotline. It's not just for suicide, but it is a national suicide hotline. Dial 988 anytime. You can, again, also text with them, and you will be able to get help right away. They will also send a mobile crisis or 911 to your address if the person on the phone reveals some significant concerns. There are also specialized crisis lines like the veteran crisis line, and LGBTQ for the youth, as well as a trans crisis line. Now, if something is severe and someone's life is in danger, or your life is in anyone's life is in danger right now, always call 911. What sometimes happens is that there's this episode of aggression at home or something very significant at home. You call 911. Of course, 911 is overwhelmed and the police comes much later. And when the police arrives at the site and interacts with your loved one, nothing really much is going on anymore. A lot of the times the police at that point does not feel comfortable taking that person to the hospital because they're not seeing anything, even though they could take them based on the information you're giving them, if it gives them probable cause to believe that someone was in danger. Usually they can do an emergency petition on the spot if they do witness or if they feel comfortable with the information you give them. If they don't, you can go and file an emergency petition. And where you can do that at your local court. So usually you have to go to a district court, your regular district court, go to either to the commissioner's window or to whatever other clerk you are guided towards. You can download the emergency petition form from online. You can Google it, or you can simply ask for one when you go to the court. If you go to the court and you fill it out, you have to wait for the county commissioner to take it to a judge for the judge to sign it. That's the only way it's valid. Once you have that signature with the emergency petition and the judge's signature in hand, you can call 911 or the sheriff's office, and they have to take your loved one to the emergency room for a psychiatric evaluation, no matter where they are, no matter what they're doing, even if they're calm and fine at that time. Now, an extreme risk protective order is also something that you can obtain. And I'm going to go, actually, I have slides for these, or a peace or protection order that can also be done. So we've talked about what the emergency petition is. When it's initiated by family, you can get the form online. You must go to the district court. It must be signed by a judge. Then you call the sheriff's office or whatever other number the court gives you. The emergency petition can also be initiated by police, by mobile crisis, or any other mental health worker, such as a licensed clinical social worker, a psychologist, any physician, a psychiatrist, and a nurse practitioner, a psychiatric nurse practitioner. Those emergency petitions can be filed in the field as well. How you can get to have those kind of individuals file an emergency petition for you, you can be at the doctor's office, You can call mobile crisis, you can call the police, and so on and so forth, or through the other numbers, 988, not 211, any place of the numbers that I've given you. If you call them and you tell them that you need a mobile crisis and you're in crisis, they will assist you. An extreme risk protective order is a court-ordered, it's a court-issued civil order, and it's a temporary order. And it requires someone, the person that you're filing the protective order for, to surrender any firearms or ammunition to law enforcement, and they're not allowed to purchase or possess any firearms or ammunition for that period of time. Now, this does require you to go to court several times. First, you have to go to the same district court, ask for the ERPO, or you can get it from online, fill it out, go to a hearing with a judge. If they find probable cause, they will give you a temporary order for 7 days, and that's where the law enforcement can go ahead and do all these things. Then you have to go to another hearing, and the final protective order will be done, and it is valid for up to 1 year. It depends on the judge for how long they want to give it to you. Why am I talking about this? This is actually created for mental health crises because the #1 suicide method is suicide by shooting. And so if you have a loved one who you know has access to firearms and you're concerned about their well-being at the time, this is a good way to prevent them from having access to that particular method of committing suicide. This does not remove their rights to have firearms forever. Again, this is only temporarily in hopes that they are going to go get help for their mental illness, and then they can return to having their firearms and their gun rights. Where can you find resources? Again, your county behavioral health services website will have all sorts of things listed. Your insurance company, Optum in Maryland, actually has all sorts of mobile crisis and crisis resources available. Your primary care doctor may know, or may know a psychiatrist to reach out to. 211 and 988 are also options to find resources. Living with mental illness. People can have a very fulfilling life with mental illness. Coping skills are very important, which is why therapy is important, because significant stressors or trauma can definitely trigger mental illness. Exercise and keep healthy, eat healthy is very important, and medication adherence is crucial. Now, depending on the mental illness, sometimes medication is not needed for life, but sometimes it is. The importance of medication adherence is this. If you have a lot of ups and downs, particularly in patients with psychosis, if you stop taking your medication, you become unstable, you go to the hospital, they force medications on you, you become stable, you go home, you have no insight, you say, I don't need meds, I don't have any mental illness. You go through the cycle over and over. Every time you have an episode that's so severe, such as mania or psychosis that requires you to go to the hospital because you are completely out of touch with reality, neurons, their brain is getting damaged, which is why early onset neurocognitive disorders happen and dementia happens before 60, sometimes before 50. Schizophrenia used to be called dementia precox in the 1800s, which means early onset dementia. It's very important to make sure for your brain health that your loved one stays on their medication. So long-acting injectable medications it's supposed to be available, and a great way to make sure that your loved one stays stable or you stay stable. I keep saying loved one, but maybe it is you. This is important because long-acting injectables can stay in your system for a month. There's some that's due 2 to 3 weeks, but a lot of them, most of them are a month. Some of them are now available for 2 to 3 months, and we even have one that's lasts for 6 months, allegedly, although it doesn't really hold for 6 months, but at least you get 4 or 5 months out of it. And it keeps the level in your blood of the medication stable. so that you don't go through the ups and downs. Even when you take the medications by mouth, the half-life is such that, you take it in the morning, it goes up a little bit, reaches its therapeutic peak in 2 to 3 hours. And then by the time your next dose is due, you're kind of like slowing down, going down in the blood, and then you peak it again, and so on and so forth. The long-acting medications are actually recommended in chronic illness because it decreases hospitalizations, decreases severity of episodes, decreases risk of dementia, and increases the quality of life. WHO has a great drawing that I got today. Tips for good brain health. Keep physically active, always important, induces dopamine, and all sorts of other great neurotransmitters. Eating healthy is important. There's an important connection between the gut and your brain in order to keep everything healthy. Getting enough sleep is very important, especially for people who suffer from bipolar disorder or who get simply have psychosis when they don't sleep. I have patients like that too. They don't have any mental illness, but if they don't sleep for a few days, they try to stay up, they drink coffee, have exams, things like that, they simply have a psychotic break. Stimulating your mind is important. Do things that are novel to you. Don't go on robotic mode all the time. You need to make new connections in your brain for it to keep healthy. No cobwebbing. Looking after your heart is important because, as we mentioned, having a stroke could impact your mental health. And of course, wearing a helmet, because again, we've mentioned that significant trauma to the brain, like if you drive a motorcycle or do extreme sports, make sure you protect your head from concussions and traumatic brain injury. Medication myths. These are some that I hear often. Psychiatric medications are toxic. Psychiatric medications are not more toxic than your Tylenol or water for that matter. In fact, water can kill you really quickly if you drink too much of it. And Tylenol is probably one of the most dangerous medications out there if you take too much, and too much is not that much. If you take more than 4,000 milligrams in a day, it can actually kill your liver very quickly. So psychiatric medications are not more toxic than any other medication that you take. Another myth is cannabis is better for my illness. Again, as I mentioned, we actually have quite a lot of evidence from countries that have legalized marijuana decades ago, such as Denmark, that early use of cannabis, particularly in teenagers who are predisposed genetically to mental illness from the family, they will become mentally ill much faster and more severe. Also, herbal medications being better than prescription because they are natural. I have to always teach my patients. We have learned to make medications by making them from plants. We have evolved from that by synthesizing and narrowing down the compounds in those plants so that they're more targeted towards what we want to use them. But herbal medications can be extremely toxic. If you don't use them appropriately, there are a lot of plants who are poisonous, even some that you use daily, such as valerian, for example, belladonna, all sorts of things that can be quite toxic. Also, a recent one, because we have a lot of mass shootings going on, is that medications cause mass shootings or mental illness causes mass shootings. That is not the case at all whatsoever. Psychiatric hospitalization myths. I encounter this daily, and it's quite disheartening because we can't help. So sometimes a family brings in a patient on an emergency petition that was signed by a judge. And the emergency petition signed by a judge, the only thing that does is allow the person to be brought to the hospital against their will so that a psychiatrist may evaluate them. Once we evaluate them, we have to make a decision. We either think that they meet criteria for an involuntary admission, and if that's the case, they need we need to go to court and commit them to the hospital. And we can give them medications against their will that way. The patient can voluntarily admit themselves after the conversation with the psychiatrist, or they don't need to be admitted at all. And so just because a judge signed the emergency petition does not mean someone has to stay in the hospital. Also, a lot of emergency petitions are filed on patients who come in under the influence of a drug, cocaine, PCP, insert here drug. And usually after 24 hours, 48 hours, those symptoms resolve. And so we have to release them. We can't keep them against their will if they do no longer meet criteria to stay in the hospital. And that sometimes infuriates family, rightfully so, but we cannot hold them against their will. That is just a human right violation at that point. Another myth is that being admitted to the inpatient psychiatry unit means that my loved one can get some sort of alternative housing, like a long-term housing or a group home. Unfortunately, that is not how the system works at all. I cannot get any housing outside of a shelter and a crisis bed, which is a bed for a 10-day stay. That is all that we can provide from the inpatient psychiatric unit. All alternative housing, such as a long-term placement or a group home, has to be done in the community, because most of those programs require the patient to voluntarily engage in the treatment. Unfortunately, our system does not really have enough help for those who do not have insight into their illness and believe that they're not mentally ill. Being admitted to the inpatient psych unit means that my loved one can get long-term placement. We talk about that. That's usually not the case. We do not have the capacity to do that. The case managers in the community can do that. And then the last one is very frequent, is that those who have frequent episodes of mental illness due to chronic drug use, once emergency petition, family wants them to go to substance use treatment. We cannot force substance treatment on anyone. It has to be done voluntarily. And so if the patient doesn't believe that they have a mental illness, or they don't believe that they have a problem with drug use and they can just stop at any point, or it's not affecting them in the way that people are saying it's affecting them, there's nothing we can do. And then the cycle, unfortunately, keeps going. And that is all I had. And I'm going to open it for questions.
And thank you so much, Dr. Freitas. I did put a few questions that I received earlier into the chat. And if you
I see them.
See those? Okay.
Yes. Okay. So I'm going to read the first one. What is the difference between a psychiatrist and a psychologist? A psychiatrist is a medical doctor. We went to medical school. We are physicians first, and we specialized in psychiatry, just like your cardiologist specialized in cardiology, and your neurologist specialized in neurology, and your gastroenterologist specialized in gastroenterology. So we all went to medical school, and we can prescribe medications. A psychologist has a degree in psychology, usually either a PhD, most commonly a PhD if they do practice as a therapist. They do not have any training in medications, nor do they have the ability to prescribe medications. Sometimes they give their opinions on medications. However, I would take that with a grain of salt, because of the lack of the education. Next question. What are the stigmas associated with mental health illness? Good question. I think that stigma associated with mental health illness has decreased, especially with a lot of the young celebrities having suffered from mental illness and trying to speak up about it. But the biggest stigma associated with it is that people with mental illness are violent. And people with mental illness are not commonly violent. Does it happen? Yes. Do I see it every day? Yes, because those are usually the people who require to be involuntarily in the hospital. But usually people with mental health issues are victims more commonly than perpetrators of anything. Also, stigma associated with people with mental illness is that they're dumb, not bright, which is also absolutely not true. And they should be treated with respect, and they should be talked to as you would talk to any adult. How are mental health illnesses recognizable in the workplace? Well, if you have a coworker that you frequently interact with, you would be able to note similar things that we talked about earlier in the presentation. You would be able to see subtle signs of maybe they're starting to be late more frequently. Maybe they don't look as put together as they used to. If they used to wear, if it's a woman, if they used to wear makeup, or a man, if they used to wear makeup and they don't all of a sudden, if they used to dress nicely and all of a sudden they're coming in sweats nowadays, if they're chronically late on their deadlines, if they appear overwhelmed, smelling alcohol on their breath, them falling asleep, some of these things. And of course, more overtly, if they're throwing things at you, things like that, that's out of the ordinary. Can you become immune to medications, and how do you know? That is a very good question. No, you cannot become immune to medications. However, there is a thing that can happen in the body that is called tachyphylaxis. And it's a very fancy pharmacological term, and it can happen to any medication, not just psychiatric medication. If you take a medication for a consistently for a very long time, sometimes your body simply gets used to it as it being part of it. And so it just becomes part of you, and then your body kind of learns how to function with that there. And so it loses its effect because of that, because now your body finds ways of overcoming that. You know, because your symptoms start slowly coming back. And if that's the case, there's several things that one can do. You can change the medication. You can reduce the dose of the medication and add a second one for a short period of time, just to kind of like jog your body, trick your body into like saying like, whoa, what's going on here? Or you can, as I said, switch to another medication or treatment option completely.
Yeah, and those are all of the questions that I've received. If anyone else has any other questions, you can feel free to put them in the chat. We're here for a few more minutes. Okay, Vanessa asked, how long does it take for treatment to take effect?
So it depends what we are treating. If we are treating psychosis, usually the effect of the medication can be much quicker, a couple of days. But if we're treating bipolar disorder, it can take a couple of days up to a week, depending on how significant the mania or the psychosis was. And if we're treating depression and anxiety, it usually takes a little longer because the medication does not take effect immediately. So it takes anywhere from 2 weeks to 8 weeks. It takes about 2 weeks to feel any effect, and it takes about 4 to 8 weeks to feel the stabilizing effect. Is it the same during a manic episode, or does it depend on the phase of illness? Could you elaborate? Was what the same? So schizoaffective, the quickness of treatment working. Yes, so when someone is suffering from schizoaffective bipolar type, you have the baseline illness is a psychotic illness. So usually you will have symptoms of psychosis even when you don't have symptoms of mania or depression, of mood issues. So someone who is schizoaffective can sometimes present just with the psychosis and sometimes will have either depressive or manic symptoms. Usually you have to treat both things, so it takes a little bit longer. Mania is more difficult to treat, so the psychosis part tends to go away a little faster. So the medications will be able to contain the hallucinations a little more faster if there's any. If delusions are the primary symptom, those also are a little bit more difficult to get at. So to your question is, if there is a manic episode, it takes about a week for stability. How often do people have to go and get re-diagnosed? Well, the topic of diagnosis is quite large in our community right now, because we have seen an explosion of misdiagnosis, especially bipolar and especially ADHD. And they are inappropriately diagnosed, and I'm going to explain why. So if someone is suffering from some sort of substance use disorder, you cannot diagnose them with a primary mental illness until they have been clean and sober for at least 6 months. Because a lot of the substances make you look exactly like a serious mental illness. For example, cocaine make you look bipolar, 100%. People who use cocaine become manic and psychotic, and they can't sleep, and they're restless. They look like someone with bipolar disorder. PCP can make you look like you're schizoaffective. Cannabis can make you look both, depending on what kind of genetic predisposition you have, how you metabolize the cannabinoids and the THC, what kind of THC you used, if it was synthetic or if it was natural. A lot of people concentrate THC, different isomers of THCs now, and they use delta 8 and delta 9. Those are very potent. I've had patients psychotic for 9 months because they had one edible when they went on vacation. It really, I would say that if you have some sort of reason to believe that the diagnosis initially was wrong because either there was something else going on, such as drug use or a new medication or an illness, I would go get re-diagnosed. But usually we don't need to re-diagnose someone very frequently. Is schizophrenia genetic? If so, how soon should children be treated to prevent or minimize the effects? Schizophrenia has a genetic disposition, which means if you have a primary relative, mother, father, and even some secondary relatives, so mother, father, sister, aunt, and grandparents. If anyone has schizophrenia, schizoaffective disorder, or bipolar disorder, it is very likely that you might carry a gene for it. I mean, not very likely. I would have to do a genetic tree to see exactly how much. Sometimes it skips a generation. You'll have someone who's suffering from schizophrenia who has children with no mental illness at all. They are only carrying the traits, and then they give that trait to their children, and their children suffer from the illness. We are struggling to identify specific genetics about this, so we cannot test about this. And we cannot treat to prevent this. The only thing you can do to prevent this is to make sure that there's no drug or alcohol abuse early in development, because if you have the genetic predisposition and you're doing the insult to your developing brain. Your brain hasn't developed, it's still creating neurons, pathways, circumvolutions, and you introduce the drug, that's when we know that the mental illness usually appears. So that would be the most important prevention, is to abstain from drugs and alcohol abuse until your brain is fully developed. And that is the age of 25. Ladies and gentlemen, your brain will fully develop up until the age of 25. Now, I'm not saying you shouldn't drink anything at 21. I'm just saying, you know, use it in moderation, but drugs, I would not recommend. Is it common that a bipolar disorder has repetitive behaviors during manic episodes? You mean like OCD type behaviors?
Hi.
Yeah.
Is it okay if I go ahead?
Yes, go ahead, Claire.
Sorry, the connection is breaking up a little bit. Oh, thank you. So the person that I'm talking about, every year when they have an episode, they talk about the same thing.
Oh, yes, yes.
About
So the psychosis is the same, or the delusions are the
it's like a broken record.
Yes.
Oh,
Yes.
okay.
So yes,
Okay,
someone who has, can you hear me okay?
Yeah.
Okay. So someone who suffers from a serious mental illness, either schizophrenia, schizoaffective disorder, usually when they become sick, they will always look the same. That's how we know, for example, I'm also a forensic psychiatrist, and I tend to evaluate people who claim to be mentally ill who are trying to get out of jail. That's one of the hallmark features of mental illness, is that every time you get sick, it will look the same. We know what your illness is like. You're going to say the same things. You're going to have the same hallucinations. You're going to have the same delusions. And the course of the illness is going to be similar. Like, let's say they take medications and they stop. Some people become psychotic the next day. Some people are able to stay stable for a few months, and you can see very subtle changes and very subtle symptoms of psychosis or mania coming back until they finally get to their full-blown episode. And then conversely, their way of getting better is the same. So they're either very fast responders, you give them the medicine, boom, 2-3 days, they're back to normal, or the next day, or they really are slower and they need more time with the medicine to get better. That being said, remember how I was saying that every episode you have is going to destroy some neurons? The more this happens, the more difficult it is to treat someone to the point where some people are not treatable and they become chronically psychotic and they do not come back, which is why it's very important to keep on the medication and prevent the cycle. Okay.
Thank you for also clearing that up too. That was another question I had. Thank you.
Okay, you're welcome. Now, how do you determine if a person is mentally stable to receive the return of their firearm? Great question. That usually has to do with a lot of different psychiatric evaluations. And they have to prove that they've been mentally stable, adherent to medications, or they didn't need medications. For example, if someone had a psychotic episode because they lost a loved one. Let's say, I'm going to give a terrible scenario, and I'm, hopefully it's not a trigger for anyone. Let's say a father lost his wife and children in a fire of the house. He tried to save them. He was in the hospital. He had brain injury from carbon monoxide and so on and so forth. And he had a psychotic episode because he lost everyone and he couldn't cope with this, right? He may have, let's say also that he's a veteran and he had lots of firearms at home. If he had a psychotic episode that required him to be involuntarily committed because he was a danger to others, not only to himself, the state is going to take their guns away permanently. They're going to be banned from NICS. But people can ask for NICS relief And after several years of showing that this was their only incident of mental illness, they were stable, they followed all the treatment plan, they were released from the psychiatrist, they didn't have any more incidences, things like that. They can go and have a full evaluation again by a forensic psychiatrist who reviews their entire life, has about a 5-hour interview with them, and then we write a report to the federal government recommending that they could be released from their NICS. If you're asking about firearms, when we do the emergency protective order that I mentioned earlier, that's temporary. And the reason it's temporary is because it's tied to mental illness treatment. So the judge is going to follow that person to see how they were doing with their treatment and how they've been behaving. So it's kind of like a treatment plan towards regaining your firearms. What are some signs in children that can show trauma? Very good question. Children in particular tend to show mental anguish by acting out. So they either become extremely irritable, or they become extremely angry and destructive, and they stop obeying any rules. They pretty much almost start being little criminals. They may have more interest, let's say it was sexual trauma, they may become promiscuous and have an excessive amount of interest towards a particular, towards sex or porn or something like that. That's not appropriate for their age. They may, conversely, some of them may become very isolated. You know, their grades are going to slip. They're going to stop talking to their best friends. They're going to isolate in their room. They're not going to eat much. They're going to not talk much with you anymore. Those are some ways. And the third way is, particularly in the younger kids, is that they regress. So if you have a 5-year-old that's traumatized significantly, they're going to start acting like a 2-year-old. They're going to start wetting the bed. They're going to start sucking their thumb again. They're going to look for pacifiers. They're going to look for maybe their blankie or some sort of transitional objects that they had when they were children. Can mental illness go away? Or if the diagnosis was correct, they have to take their medications forever? Depends on the diagnosis. So if someone has depression, major depressive disorder, we have evidence that it can actually go away. So the first time someone has an episode of major depressive disorder, we recommend the treatment for about 3 to 6 months. And then therapy medications, then you try to come off of the medication, especially if the stressors have improved. You know, now you have more stable things in your life, or whatever was bothering them at that time is better. They can go on without any medications, and it would be, their diagnosis would become major depressive disorder, single episode, severe, or whatever it was, moderate, in remission, in full remission. That's it. That's just in their past. If the diagnosis is schizophrenia, schizoaffective disorder, a bipolar disorder, delusional disorder, autism, obsessive compulsive disorder, things like that, usually they will not go away. If they were correct diagnosed, it will not go away. And you will have to be on medications forever.
All right. Thank you so much for all of that information. It was quite insightful. I learned a lot. And thank you again for the presentation on mental health awareness and best practices on when to seek support. We hope that all of you found this presentation helpful and got your questions answered. And thank you again to our MedStar team and Dr. Freitas for this collaboration on this very important initiative. This information has been recorded and will be available on MedStar's pages as well as Arc of Knowledge's Facebook and YouTube pages. So please feel free to share. And we hope that you'll continue to join us for the next few months for the rest of the Ask the Doctor series. Thank you and have a great evening.
Thank you
Thank
so much.
you.
Have a great evening.